I'm Mark Murray, Lieutenant in charge of training here at Bedford Park. If you don't know our facility, the bathrooms are back around the corner, water fountain, coffee in the rear. Anything crazy happens, burn the building down, escape over there, stairs there. Today, our guest speaker is Dr. Margaret Jurgenmeyer, affectionately call her Dr. Margie. She works at IFSH, Institute of Food Safety and Health. She's got us exposed to a lot of fun stuff in the past with her building and unique stuff over there. But for today's presentation is Ebola and the first responder. She'll do her presentation, there will be some Q&A, and today we're recording. So, thank you. Dr. Margie.
All right, well, thanks everybody for coming. There's a stack of 3x5 cards at the front of the room, and everybody pretty much should have at least one 3x5 card in front of them. And those are for all of the questions that you're too embarrassed to ask. If you're sitting there thinking, I have a question, but it's really stupid and I don't want to open my mouth, write it down. Don't put your name on it, just print so I can read your handwriting. I'll collect them, I'll answer them. If you've got a question that you think is smart enough to ask out loud, that's perfect too. But I don't want anybody to feel embarrassed to ask a question today. So always, always ask questions, interrupt me, we'll have plenty of time for questions at the end. Whatever works for you guys works for me. So, Ebola, let me grab out the clicker here. The first thing we're going to be talking about is what exactly is Ebola? And because I am a science nerd, yes, I have a stuffed Ebola. I've had it for about 8 years now. I have a whole collection of these. Yes, I have anthrax and bubonic plague too. They're adorable. So you'll see a lot of this little guy. He helps me illustrate some of the various points during the talk. But that's the real picture that the stuffed one was based on over there on the right. Ebola is a single-stranded RNA virus. It's in the family Filoviridae. You'll hear it called a filovirus. There are 5 known subtypes. 4 of them are associated with human disease. 1 has been only associated with primate disease so far. And you've all heard about the ongoing outbreaks. You know it's in Sierra Leone and Guinea and Liberia, and that those countries, they've got a big problem. The problem is getting worse. The problem is spreading. Senegal and Nigeria have each had an imported case. They may or may not have had a little transmission inside the country, but they've got it under control. Both of them have recently been declared Ebola-free, which that's good. That's wonderful for them. Spain and the US, it's been imported and then transmitted. There have been a number of countries where they've had a single or sometimes as many as 2 imported cases that haven't spread at all. And many, many false alarms. Just this morning I read that over in China they've had over 5,000 false alarms so far that they've kept track of. So yes, everybody's scared of it. But has anybody heard about the Democratic Republic of the Congo? They're having an outbreak right now too. It's not related to the Sierra Leone outbreak. It's a different subtype. They've been keeping it under control as well as they can. They've been treating it just like every other outbreak they've had to deal with since the 1970s. It's not making the news because it's not spreading to the US. It's not completely out of control. So how do people get Ebola? That's the first question in everybody's mind. How do I get it? And the current research is that fruit bats carry the virus. You've all heard about other organisms. It looks like fruit bats may be the natural reservoir. And the thing about bats is when they eat messily. They get to a fruit, they take a couple bites of the fruit, maybe they knock the fruit out of the tree, they drool saliva on the fruit, they poo on the fruit, it lands on the forest floor, or even it stays in the tree. And then if another animal eats that fruit, it can ingest that saliva, and that may be one of the ways of passing Ebola to other animals, like chimpanzees, like some of the forest antelopes, some of the other animals that you hear about, sometimes people getting Ebola from it. If you kill or eat a bat, that is one way to get Ebola. If another animal has eaten a bat or has eaten the fruit that the bat has drooled on and is carrying the virus, and you kill and eat that animal, that's another way that you can get Ebola. Fortunately for us here in America, it is very, very rare to be able to go down to the grocery store and get bat meat or chimpanzee meat. This is not a big concern for us. The symptoms of Ebola long list of symptoms. You're just going to start with fever, body aches, stomach pains, vomiting and diarrhea, and hiccups. This is one of the ways this particular outbreak was identified early as Ebola instead of something like dysentery, was that people do have the hiccups. After a while, you start to get a rash. You can get bruising on your body, hemorrhage from the body orifices. This is the one everybody hears about and thinks about. And people die from it. 60 to 90% fatality rate for some strains. Not all strains, but some strains. And this is the part that scares everybody, which is a fairly legitimate fear. But the thing is, remember the early symptoms. Human bodies aren't very imaginative when it comes to fighting off disease. You're starting with fever, body aches, and vomiting. Well, guess what? It's flu season. Fever, body aches, vomiting, and travelers from that region, there's more going on over there than Ebola. Cholera, dysentery, they're having a huge measles outbreak. They could have Lassa, hemorrhagic fever, instead of Ebola. There are all kinds of things that exist worldwide with those same symptoms that are not Ebola. It is contagious. The incubation in a human is 2 to 21 days, so that's quite a long incubation rate. The big thing to remember is it's not contagious before there are symptoms. If somebody is just walking down the street, even though they may have the virus in their body, they're not contagious until they start to show those symptoms. And the communicability increases with the symptom increase. You get a fever, you're slightly contagious. By the time you're vomiting and diarrhea, yeah, you're pretty darn contagious. And yes, if you are one of those unlucky people who is oozing blood, that's extremely contagious. You have to consider those body fluids to be contagious. All body fluids can carry the organism. Blood, vomit, fecal material, tears, sweat, breast milk, semen. All of these body fluids, cerebrospinal fluid, anything you can encounter could be carrying the virus. Strangely, human saliva, unlike bat saliva, is considered very low risk. Not impossible, very low risk. And equally strangely, recovered men can have semen, or can have Ebola in their semen for up to 3 months after they are recovered. Let's take this apart for just a sec. Ebola is not a day-to-day disease in West Africa. It comes and it goes. So that must indicate that, okay, some men can have the virus in their semen for 3 months after an outbreak, but not all. It's not a universal thing. If it were, you got to figure it would be almost a continuous low-level disease. So remember, you can recover from this. You can continue on to have a fairly normal life after this. And the big thing here in America is fear is the worst enemy you could possibly have when you're dealing with this disease. I've never seen it before. It's new, it's strange, it's scary. It's been in the United States before. We have many areas that are doing research on Ebola virus. There have been needle sticks. There have been, people kept in quarantine, fearing that they've come down with this disease. So far, we've been lucky here in America, and they haven't been. One of the strains was named after Reston, Virginia, where it was discovered. That's the animal-only strain, and it's later been found in Pennsylvania and Texas in primate colonies. It has not jumped from animals to humans the way you hear about people trying to scare you in the movies. Marburg hemorrhagic fever, which is very closely related to Ebola. A woman was in Africa. She went hiking in a bat cave, came home, was sick, was brought to the hospital, recovered. She had hundreds of potential contacts while she was sick because nobody knew what it was. 7 months after she recovered, she read a news article saying that someone else had been in that same cave, was diagnosed with Marburg. She went back to her doctor, demanded to be tested for antibodies, and sure enough, that's what she had had. Nobody else in America got it. Were they lucky, or did they use their proper infection control practices? If you're thinking, it's a directed organism, it wants to kill me personally. Well, remember, 60 to 90% fatality rate, that's scary. That's very scary. But you guys already encounter something with a 99.999% fatality rate, and you don't think too much about it. Anybody remember what it is? We have it here all the time. Rabies. You encounter that, you don't even think about it. Oh yeah, I just grabbed a dog, let's just get a gun and shoot it. That's a scary disease, just as bad as Ebola. But remember, 3 of those 5 strains have a fatality rate of 0 to 25%. So not everything is going to be that bad. It's a fairly low transmission rate. It really just hasn't spread like wildfire in a country that has a good medical system. Let's face it, worldwide, even including these big outbreaks, worldwide, more people are killed by being struck by lightning every year than they are by Ebola. And of course, as soon as you say the word Ebola, everybody imagines that scene from Raiders of the Lost Ark where the Nazis have opened the Ark and they're all melting into puddles of waxy ooze. And that is everybody's mental image of Ebola. But the victim, they're going to look like they feel like crap, because they do. They look weak. They look sick. They're vomiting. They have diarrhea. They're dehydrated. A lot of them get so dehydrated that they have the cardiac symptoms that go with severe dehydration. Bleeding out occurs in a very small percentage of cases. Yes, it's a scary, scary symptom, but you are very unlikely to see an Ebola victim in the process of bleeding out, which you're probably all wondering why I don't have pictures. I don't want to exploit people who have this disease. And the big thing to remember is you have been taught to fear Ebola. It is the scary word. When the media wants to use a scary name, they use the word Ebola. These books, I have these books. I enjoy these books, but they are fiction. They are using the word Ebola as a boogeyman. And now the boogeyman, that creeping hand that scooches away from the campfire, remember that one from 3rd grade? It's actually here. And that's what people are so scared of, is discovering that this thing, that they were willing to laugh at it because it wasn't real, but now it is real. And this is why there's such a fear response. All right, so when it comes to infection control, remember it's a disease. You have been trained on infection control. You have the policies, you have the procedures, you have the practices. You know this already. The crew that transported the Texas victim wasn't wearing specialized PPE, and you don't know their names because they didn't become sick. They weren't doing anything special. They weren't told, as far as I know, that he had Ebola, and they were just as safe as anybody else. I want you to imagine showing up to a horrible motorcycle wreck. Some guy has absolutely wiped out on I-55, and he's lying there, starting to recover consciousness, so he's thrashing a little bit, blood coming from his nose and mouth, the bubbles are popping a little bit. As you're walking towards him, his buddy, who wasn't injured, grabs you and said, he's HIV positive. What would you do to protect yourself in that case? If you can protect yourself from that, you can protect yourself from an Ebola victim. Couple of buzzwords. You can't catch Ebola around a corner. It is not an aerosol transmissible disease. It is not like norovirus. It is not like the flu. If it spatters, then it matters. Any kind of spattery material, any droplets, sneeze, cough, blood, vomit, diarrhea, these are the things to pay attention to. If you take nothing else, question.
How long does it live outside the body?
Depends on what it's on. It's fairly fragile, so not very long, but if it is in a liquid, it will live longer. So it can live a couple of hours depending on temperature and depending on whether or not it's exposed to sunlight. PPE, remember to use it. Donning and doffing are the big things about your PPE. Put it on properly, take it off properly. Your trainers have probably yelled at you about this for years. This is the time to remember how important it is. Again, you guys aren't nurses. You're not having the prolonged daily contact that the nurses who are taking care of these patients are. You get in, you do your job, you get out, you have the time to decon yourselves. Cover your mucous membranes. Everybody's saying cover yourself head to toe. Well, that's a fantastic thing. In an emergency, cover your mucous membranes. It cannot penetrate intact skin. If you have an open wound, that could be a problem. But keep it out of your eyes, nose, and mouth. Keep your hands away from your face. This is actually something we work on for hours in a biosafety level 3 laboratory. It is stunning how often people just put their hand near their face just to do a little something, just to adjust their glasses, fix their face mask, whatever it is. Keep your hands away from your face as much as you possibly can. The CDC has released guidelines for healthcare workers. Again, training, demonstrated competency, no exposed skin, and they want a trained observer to ensure that the protocols are followed. This will be difficult, but doable. They've got a separate checklist for the EMS Ebola preparedness. I know Mark has that. He's probably been running you through it. Use a PAPR, positive air purifying respirator, or an N95 respirator. There's some argument about whether or not an N95 is good enough, so if you want to use a P100, go for it. Disposable water-resistant gown or coveralls, some kind of front clothes, anything. Double gloves, boot covers, optional disposable apron to cover your lower legs. Again, this is for the nurses who are caring for these patients day in and day out. And yeah, that will happen to every single one of the people that gets in that. Your level C hazmat, stuff you've already trained with, it's overkill. But you have it, you're trained in it, so use it. But the PPE cannot protect you if you don't use it properly. If you leave the hood hanging, if you let your respirator dangle a little bit because it's uncomfortable and it's pinching your nose and you don't like the way it fits with your glasses, PPE does you no good in a box. Most of the cases in a healthcare worker, whether it's in the United States or over in Africa, have been tracked to either improper PPE fit, use, or removal, or in the case of the people over in Africa, often they think they were exposed when they went to the grocery store, when they were out and about, in the city somewhere. They were exposed somewhere other than work. But the secondary cases in Texas are an example. There's quite a lot of back and forth in the media, who was at fault and were they properly trained, and back and forth and up and down. But before a diagnosis was made, they weren't treating it as an infectious case. What would they have done if the guy had had norovirus? How many people would have been infected had it been something like tuberculosis? Okay, the symptoms were all wrong for tuberculosis, but when is it an infectious case? When do these people start treating it as an infectious case? I don't know. That's the policies of that particular hospital. There's some people saying that the nurses